I can make it a more aggressive stretch by bolstering or putting a little towel roll under the knee and doing the same thing. For medial inferior hip capsule, I'm going to get you to move just a little bit to the right. And what I would do is I'd bring her up into a figure 4 position. And what I would do is I would actually just kind of look at the lumbar spine to sort of see when everything kind of starts to move, and you could actually feel that there's some tension. Usually when you let the foot go, it usually comes bogs. I like to support the foot. Hand positioning is very similar to the anterior, and it's just the same thing. It's A to P. Oh, a little tongue there. Sorry, I should have gone the other way. I thought this would have been better.
This is just a variation, or we're doing the superior lateral then?
This would be medial inferior.
Medial, okay.
Sorry, medial superior, because I'm pushing upwards. You could also come up into a full figure 4, and then position is the same. And you could double check with your patient and ask if she can feel through the groin. Yes, no? Yep. Yeah, so. I can tell it's actually not terrible. For medial, a true medial inferior is the force is medial and inferior. In positioning, you would come around from the opposite side, and you know you're kind of getting it because if you look at the foot, it's bobbing. Moving femur from internal and external rotation. You'll often find that people have a lack of internal rotation. The capsular pattern of the hip is internal rotation, limited first, followed by external rotation, then extension. Posterior hip capsule, I'm going to get you laying on your back. Strict posterior hip capsule for people who have tight posterior element. You could say there actually, sure. People who have tight posterior hip capsules, when you assess your squat, if people are tight through their butt, you could do whatever you want to kind of teach them how to bend correctly, but if they can't move through the back of the hips, they're not going to be able to do it very well. They're not going to be able to engage the glute, so you're going to always have some instability and things aren't going to go really well for them. What I would do is, in this position, to sort of see where their hip capsules or how their posterior element is, I would just kind of come across the body this way, and usually, or you can scour the hip and you can usually feel that they're tight. She's not tight, but I'm hoping I can maybe find a stretch on her anyways. I'm going to get you to move closer to me. I want half of your right rear end hanging off the table. I'm going to support it with his hand so my patient feels safe. And it's basically an axial load, slightly going a little lateral to the body. So I'm going to adductor just a little bit, and I use, because I'm little, I kind of use a little bit of my body. And you feel that through your rear end? Mm-hmm. And that's posterior. Okay. And I think it tends to couple nicely with things like any kind of piriformis stretching or anybody who's really, really tight. Nice way to bring back some of that anterior pelvic tilt for somebody who's very posterior tilted.
Good. Anything to add? I think that covers. Which way do I want to do this? This way? I'm going to turn it this way. That going to work out that way? So we look like this, right? Remember this, erector spinae? Am I doing that right? Again, I'm not really paying a great deal of attention, but that is the position, right? So like this, right? So what do? They're pushing back through this contact. Do I have that right? Confirm that for me. What do you think? Does that look right?
Yeah.
We're going to rotate back here, and then relax, and then they may have had the leg, but I think that was more QL that he did that, the two layers of the QL. So just make sure you get down low, you're not coming straight down. Nice low line of, drive here this way, stretch out that way. So we're going to come right down like that, okay? All right. Anything we want to add to stretch to that?
I think your take-home message would be...
So you can lay, lay on the sink, that side there. So we would maybe roll up a towel or a Dutchman's roll underneath here to put This the lumbar spine and a little lateral flexion, so that would open this up here, right? So the first one we could do, let's bring this one. Leg in front, first part of this, right? Contact over the iliac crest here. Come down low. I'm bringing down. This arm gets elevated. Up. I don't like if they grab too hard and pull up, because then they're going to contract a lot of things. So it's right here. I find the barrier, and then we would go through the PIR, right? And then they would relax, and we'd find the new one. So first part of that, and the second part, right? Same thing here. Elongating this area, elevating the ribs, pressing the pelvis, and again, we come in, make a nice contact, and we go through our stretch, right? Find the barrier first, the breathing, we can get into the eyes and all that stuff, but then down, right? Okay. Let's see, I did that a little more aggressive one, where you're right at the edge, arm over the top, contact on the lower ribs, so it's up, IDA, strong IDA S. Affected side off the table. Keep them from rolling forward. There's the pressure there. My hand, lateral aspect of the knee here, and then they would resist, they would abduct their leg up towards the ceiling, right? So that would be the contraction, relax, let it drop towards the floor. And that would be it, right? I think that's it for the manual ones. And then we did some floor, you showed some, right? Was there another one? You just kind of grab the edge.
I could probably do that when I'm
Yeah,
not.
kind of sitting back, and I'm real tight here.
Go ahead.
That's why I'm doing this, okay? And I'm not gonna, I can't wait the whole weekend. I gotta talk to you guys after we're done here. So
what I would do is I could do knees a little wider. No, knees and feet a little wider. There you go.
I'm a little tired, a little bulky, you know. I have been, it's those subs on the way home. So that's one way.
Yep.
Kind of sitting back.
Correct.
That way, right?
So introducing side bending, and you could ask your patient to flex or extend.
Another option, on their back, pulling off this way. I'm raising this arm, elevates the ribs.
This is actually
Lats.
really good stretch. As
You
long
can
as you're
even put a little extra, I kind of pull my leg down and over here, so that one there. You can do one standing, I think you showed a standing.
standing stretches this way. So I'm stretching my left QL. Stepping forward with my right arm, left arm, maybe a door frame, and all I'm doing is kind of lunging forward and pushing away. So you could push away, it just depends on who your patient is. Sometimes people will get it this way. I'll oftentimes combine that with a psoas stretch, maybe foot up on a stool. That's that frontal plane stretch that I showed you for the psoas.
How about an ITB stretch? Because I'm going to just show one on the table. It's very similar to
I was going to say I would do the same thing. I would just probably use a little bit more adduction.
Left ITB?
Yeah. And then there's always, like, you know, your classic, which I don't love because I treat so much lumbar spine, which is basically crossed over and it's a forward.
Scares us to be
Yeah,
like that.
yeah. Don't let your patients bend forward.
Let me show just a sideline ITB stretch, a kind of lateral hip stretch, okay? You want to just go down here, facing that direction. This one, the involved side is down. Patient's leg comes up here, heel, foot on the table. I'm going to come in with my thigh. Make sure you tell them what you're doing here, okay? I'm going to kind of try to, and I'm going to make contact down at the ankle, but most of my pressure is at the knee, so I'm not cranking on the knee joint. I'm locking her pelvis. If I just don't do that, the whole pelvis kind of elevates and rotates here. So I'm locking it in. Oh, yeah.
That's okay.
I'm sorry. That's your affected side.
It's not that. You're fine.
Yeah, labor. Let's see what we can do. But that's it, okay? I'm locking in here, okay? So that can't